So the next PYT is neck femur fracture. So when we study the neck femur fracture, so we always study the intertrochanteric femur fractures. Why? Because most of the time they will ask you the difference between neck femur and intertrochanteric femur fracture. So what is the difference between both fractures? So this is acetabulum, this is femur head, and this is femur bone. These are the condyles of femur. This is shaft, this is distal part, this is condyle, and you can see this is the neck of femur. Okay, so if the fracture line is through the neck, then it is neck femur fracture. Okay, and the this is greater trochanter and this is lesser trochanter. Okay, so if the fracture line is between the greater trochanter and lesser trochanter, this is known as intertrochanteric femur fractures. Okay, so both fracture present in old age. Okay, both fracture happen with a trivial trauma. Patient will present with flexion, abduction, and external rotation. So this is the attitude of his limb. So now how will you make a difference between it is a neck femur fracture or intertrochanteric femur fracture? So you have to understand this is neck femur fracture. So if the fracture is around the neck, the blood supplies is very precarious in femur head. So if there is a neck femur fracture, there is also it leads to disruption in blood supply of femur head. Because it leads to disruption of blood supply in femur head, the femur head will go in necrosis. हर जगह बॉडी में ब्लड की जरूरत होती है. So if अगर कोई भी बॉडी पार्ट में ब्लड नहीं जाएगा तो दैट विल लीड्स टू नेक्रोसिस. सो नेक फीमर फ्रैक्चर में क्या होता है कि it leads to disruption of blood supply to femur head. So femur head will goes in avascular necrosis. So because it goes in avascular necrosis, so हम क्या करेंगे? अगर कोई खराब हो जाती है चीज, अगर गैंग्रीन हो जाता है तो हम क्या करते हैं? हम उस एरिया को निकाल देते हैं, काट के निकाल देते हैं, है ना? तो ऐसे ही फीमर हेड में नेक्रोसिस हो जाएगा तो व्हाट विल वी डू? वी विल रिमूव दिस पार्ट. We will remove this part and replace it with a prosthesis. We will replace this part with a prosthesis. So in neck femur fracture, if the age is greater than 50 or his age is greater than 65, then we will replace the femur head with prosthesis. The prosthesis could be AMP, that is Austin Moore prosthesis, or bipolar. Okay. Now the question arises: how many years till how many years this prosthesis will work? So it will work for 10 to 15 years, and then you have to replace it again. This prosthesis you have to replace with it again. Now, so if a patient came with 57 year of age, so we have replaced this head and we have put a prosthesis in neck femur fracture. So because we assume 15 to 20 years ये चल जाएगा और तब तक पेशेंट मर जाएगा 70 to 72. Okay, nahi marega, so we will do another surgery and we will do total hip replacement. After doing the prosthesis replacement, that is bipolar or Austin Moore prosthesis, we will go for, after that we will go for total hip replacement. Now so we know the age of prosthesis is 15 to 20 years. So we used to do it in a late age. Now let's assume a patient came to you with 30 year of age and he has neck femur fracture. So you can't replace this his femur head with prosthesis, because आप उसमें prosthesis डालोगे उस patient में, prosthesis 45 तक survive करेगा. Then you have to replace it again. Okay, that's why in young age patient, we will try to salvage the femur head by putting the CC screws, cannulated cancellous screws. So we will try to put cannulated cancellous screws here, 3 or 4 cannulated cancellous screws, and we will try to preserve the head. Okay, so in neck femur fracture, because the femur head blood supply is disrupted, that's why in young age we will put the cannulated cancellous screw. In old age, because the femur head is gone, femur head gone in necrosis, so we have to replace a necrosis part in the body. So we have replaced that necrotic head with a prosthesis, that is bipolar or Austin Moore prosthesis. Okay, this is neck femur fracture. Now, how will you make a difference between a neck femur fracture or intertrochanteric femur fracture? So pain in the femoral triangle you will find in neck femur fracture, because the fracture line is, आप ये देखो यहाँ पे ये fracture line है और इसके ऊपर ही femoral triangle होता है. That's why pain in femoral triangle. And in case of trochanteric fracture, intertrochanteric fracture, pain in the trochanteric region. And it is an intracapsular fracture because it is inside the capsule. So it is intracapsular, and intratrochanter is extracapsular fracture. And the complication I have already explained to you. The femur head will go in avascular necrosis. Okay. And in case of intertrochanteric femur fracture, if you will not fix that trochanteric fracture, that will go in malunion. Okay. In less than 65, we will go for CC screws. Greater than 65, we will go for replacement. Replacement is known as joint replacement is known as arthroplasty. Okay, joint replacement is known as arthroplasty. Why it is written as hemiarthroplasty? Because we are only replacing the femur head by bipolar or Austin Moore prosthesis. So that's why it is written as hemiarthroplasty. If we will also replace the acetabulum, then it is known as total hip replacement. Okay. Now, how will you treat the patient with intertrochanteric femur fracture? We have to do, because the blood supply is intact, so we will do proximal femoral nail. So you can see this is proximal femoral nail. So you have put the femur nail, a proximal femur nail, and you can see these two screws. So this is an intertrochanteric femur fracture. You can see this is the fracture line. So you can see this is intertrochanteric femur fracture. This is the fracture line. Okay. Now this is the neck femur fracture. You can see intertrochanteric line is intact. There is no any fracture here, and you can see there is a fracture at neck femur. You can see this line. So this is neck femur fracture. So it is very easy to identify whether it is a neck femur fracture or intertrochanteric femur fracture. Now we have various classification for neck femur fracture. So you can see this is the that is a Powell classification and anatomical classification, garden classification. Okay, and there are various reasons why it is why fracture goes in non-union in neck femur fracture because of decreased vascularity. I have already explained to you, and there is a synovial fluid which is invade the healing and periosteum around the neck of femur legs, the cambium layer that has progenitor osteoblasts. Okay, so these all condition leads to non-union and neck femur fracture. That's why we are replacing the femur head. We are not salvaging the femur head in old age people. In young age people, we have to salvage the femur head. Otherwise, we have to do multiple surgeries during his life. Okay, that is not possible. Okay, we don't have various implant. Okay, so this is the anatomical classification of subcapital, transcervical, vesicervical neck of femur fracture, and we have Powell's classification according to the fracture. So this is less than 30-degree type 1, then 50-degree type 2, then greater than 50 degrees type 3 neck femur. Then Gardner classification. So we have undisplaced and incomplete, then undisplaced, complete, then complete fracture, in incomplete displaced, and type 4 is completely fracture and completely displaced. So these are the classification for neck femur fracture. So these are my notes from my rapid revision course of orthopedics. I have covered entire orthopedics in just 3.5 hours, and these are my notes. So if you want to join my course, so you can download the Dr. Priyesh Nayak app, and you can watch the free videos of upper limb trauma if you like the video, and then only purchase the course. Otherwise, don't waste your money. You can continue with your primary source. Okay, thank you so much.